We are sponsored today by Fieldstone Memory Care, Bainbridge Island. Fieldstone offers innovative and compassionate care, now accepting residents. Call 360-271-2530 to schedule a tour of Fieldstone's beautifully appointed apartments on Rolling Bay. And that number again is 360-271-2530. Thank you to our sponsors, Fieldstone. Today, I'm very happy to have with us Marilyn Gremse, who works with Helpline House as one of their social workers. Marilyn's joining us today to talk about Medicare, all sorts of things Medicare. We're currently coming up on open enrollment, or we're in open enrollment. So Marilyn's going to give us some great information today. Marilyn, go ahead and take it away, and thank you for joining us today.
Okay, thank you. Happy to be here. So I thought I'd just give a little bit of basic information about who I am and what kind of services we can offer at Helpline House and beyond with regard to Medicare. So I am actually trained specifically in Medicare through the Office of the Insurance Commissioner. It's a branch called Sheba, which is the statewide health benefits advisor program. But I actually am based at Helpline House and take appointments at Helpline House to talk to people about Medicare. This is a year-round service, so I can talk to people who need general information and education about their Medicare choices as they're approaching Medicare, or if they have basic questions about their coverage. So that is a year-round service, and many people who are approaching Medicare age are looking for education about what they need to do and what their choices are. And we do that in a couple different ways. One is I do presentations often through the senior center here that is Medicare Basics or New to Medicare, which is an hour-and-a-half session, usually about once every quarter or so, which will give you a good basic understanding of the Medicare program. And then I also do one-on-one appointments. Currently, we are either web-based on Zoom or on the phone for those appointments, but I am anticipating in January we'll be able to resume in person, both here at Helpline, and I have one appointment slot a week at the senior center to do those appointments. So the one-on-one counseling is usually helpful for people who need to sort out their decisions. And sometimes it's even more than one appointment so that we can do a follow-up and actually get things pinned down. It can be quite a process to get involved in Medicare, but I can help guide people through that. So that's kind of the New to Medicare program, the year-round service, and how to kind of get started. Right now, for people that are already enrolled in Medicare, right now we have what they call open season. Open season is an enrollment period that anyone who wants to assess their Medicare choices and possibly make a different choice can do so. So it's open every fall, and people can find assistance through myself or other Sheba advisors as to whether they are on the best fit program for them. The most common assessment that people do at this time of year is if they are on original Medicare and have a prescription drug plan, assessing whether that prescription drug plan is the best fit for them. Is something that I actually recommend everyone do annually if they take medications, because not only the premiums for the plan can change, but the coverage and the pharmacies where the coverage is available can change. all this information is available online at medicare.gov. So people that are into do-it-yourself and very hands-on on the computer have a online account with Medicare and can sort through these possibilities themselves. But I also guide a lot of people in that process. I do that on Zoom often, works the best because I can share the screen and we can see together what the results are from the searches we do. The individualized search does require putting in medications. Once we do that, then we can tell what the best fit is for your situation and the medications you take. So during open enrollment, however, people can also assess if they are on an Advantage plan and want to change back to original Medicare. We can talk about whether that's a good option. It is possible, but there's several things to look at, including whether you can get a supplemental plan, or if a person is low income, there is other options for the state to help pay. So people can switch between a Medicare Advantage plan and original Medicare. If you're on original Medicare, you can also assess whether you'd like to move to a Medicare Advantage plan. The Advantage plans, you probably, many of you may be getting deluged with mail right now. They do a lot of direct marketing to Medicare aged folks. And those are the plans that bundle prescriptions along with the medical care and offer additional benefits. Actually, there are things like dental care, vision care, hearing, gym memberships, and so forth that are not available under original Medicare. So again, a lot of this information is online at medicare.gov, and walking through their question and answer, you can sort out a lot that way. But some people would like to have the one-on-one consultation to work through that, and I'm happy to do that. Open enrollment will be going on through December 7th. But for assistance right now, I do have to tell you that I no longer have any one-on-one appointments just because of the timing. I'm fully booked. But I do want to share the Sheba number, which can get access to another advisor who has the same training as I do. So I can share that now. And there's two numbers. One is the general Sheba number. It's a 1-800 number. 1-800-562-6900. There's also a local number, same thing, is a 360-475-3095. Those numbers will reach a screening line, which will simply get your information and connect you with a Sheba advisor who will get back to you, make an appointment and get back to you. So those are kind of the basics of open enrollment and the broader picture of what I can do as a Sheba advisor and Medicare specialist. I'm always happy to help people assess their benefits under Medicare, as well as other programs. So in my role as a social worker at Helpline House, there may be other programs that a person might not know about that they could be eligible for. And that's kind of a corollary. I do it parallel with the Medicare session. It's just to check in to see if there's any other access to benefits or programs that might be of benefit to a person. Let's see. So just one other thing I want to mention, and then I think Katie can ask me questions. Most people who are on Medicare already receive this, and it might blur, but there is a book called Medicare and You. That's not coming out really clear. If anybody needs a copy of this, please let me know or ask Katie, and she can get that information to me and I can send you a copy. It's a kind of half-inch thick brochure, and it tells you all of the basics about Medicare for this coming year. Not the specific plans, those are on Medicare.gov, but this gives you the basics of how Medicare works and what the benefits are available to you. So that's kind of my quick 10-minute summary of Medicare. Not quite everything you need to know, but it's kind of where we're at right now. So
a lot of great information, Marilyn, as always. So thank you. I do, in fact, have questions, and I'm also happy to open it up in case any of our guests have questions. So currently everyone is muted. If you do have a question for Marilyn, you can go ahead and unmute yourself and jump right in.
Yeah, I have a question, if I might. This is something that sort of confused me anyway, Marilyn, all the way through. I have Kaiser Medicare Advantage.
okay.
And I've had it for quite a few years now, and it's very impressive, and I get what I need and so on and so forth. It's done very well because Kaiser does a good job of referring me to even outside of the network, so which is good. It's really good. Anyway, the thing that I was wondering about was not so much dental, but certainly hearing. And optometry, I don't have to worry about because that's all part of the Kaiser program. They have optometry. So, but for hearing, I'd have to go outside of the program, and that gets really expensive. And I just wondered, I don't want to fool with what I've got. Shall I say that? I like what I've got, and the only thing that I found that was difficult for me was about 1.5 years ago, I found that I was not able to use a certain pharmacy or certain pharmacies, that they were, that it really became, it depended upon what the program was. And I wasn't able to use, my favorite one, which is the community pharmacy here in town, which I was really surprised about. So that's a long way around saying, so what do I do?
Well, let me try to focus on what I'm hearing you ask specifically. It sounds like you're really happy with your plan, with the exception of the coverage for the hearing. Okay, so let's address that first. So hearing, although often in the Medicare Advantage plans, there's some coverage for hearing, it's going to depend specifically on which plan you're enrolled in. So to know exactly what your benefits are, you do have to go back to Kaiser to look up your specific plan, and they will tell you exactly what your benefits are. It is, even under original Medicare, anything durable equipment wise, and hearing aids are a durable equipment, are often not covered. So even if the hearing assessments and so forth are covered under a plan such as yours, you may be finding that there's still a cost to purchase the hearing aids. And that again is going to depend on your plan, and original Medicare would not help you. So your choice of going from an Advantage plan to original Medicare actually would get you fewer benefits in terms of hearing than staying where you're at. And essentially the same applies to the pharmacy. Your plan with Kaiser determines which pharmacies they will outsource to, or whether you need to go to their in-house pharmacy. You would not have any additional coverage outside of where they refer you. So they have control over which pharmacies they contract with. So, you know, I'm sorry about community pharmacy, but going to original Medicare, you might find on a plan D, you could use community pharmacy, but you might find that it costs you more. So, you know, typically the Advantage plans overall are less expensive than original Medicare with the supplement and a plan D. So,
you know, I was not upset. I'm not so much of, I'm upset because I want to use community pharmacy because I want to back that group of people there. I think they're absolutely magnificent. We are so fortunate in this community to have them. So that's the reason why I would want to do it. Other than that, you know, I order something in the morning from Kaiser and I get it the next day.
Yeah.
So, I mean, it's not anything that, and if I needed to get it right away, I could just drive up to Polsbo and get it. So
That's
it's not that bad. It's just that it was really, I was upset about not being able to use my friends at community
Well,
pharmacy.
go to them for all your over-the-counter needs because that's not covered.
I'm sorry, say that again?
Oh, over-the-counter medications.
Oh, yeah. I can still go there for that. Yes,
Yeah,
indeed.
exactly. So, great. Okay.
Yeah. Thank you, Sheila. And you bring up a great point. And I was also going to just ask along those lines. So Marilyn, even for someone who is overall fairly happy with their plan, year to year for open enrollment, do you still encourage folks to check in and kind of review plans and see what changes have been made?
I do. Especially if they have a Plan D, a prescription drug plan. It's always worth checking to see if anything has changed in terms of the drugs they're taking. Sometimes people will start the year out with a certain medication regime and then things will change during the year. So looking at what's going to happen in the coming year is a good idea. Premiums change too on those drug plans a lot. So with original Medicare, people have supplements and those are different. Those are private insurance that are privately contracted. You can assess those at any time. But the prescription drug plans assessment and changing of plans only can happen during this open enrollment period. So.
Great, thank you. Another question that I had, because I know you had mentioned that folks might start to get mailings, start to see more and more information out there. Are there any, well, I know there are, but any new scams, fraud that's popping up that people maybe want to be aware of? Or, you know, if there's any question or uncertainty about information, you know, if they're getting phone calls, how can people keep themselves safe from any sort of fraud at this time?
Right. So I guess the first thing to know is that unless you've signed up on a card or seen somebody at a in-person workshop and told them, yes, they should call you so you can learn more about their plan, no one should be calling you on the telephone. So it's important to know that you should never provide any of your personal information over the telephone, no matter who calls you. Even if they say they are Medicare or they say they are Social Security, it is not ever true that they are going to call you and ask you for your Social Security number or your Medicare number. So never give those to anybody over the phone unless you've made that telephone call and connected with a company that you want to enroll in. That's different, but them calling you is not going to happen. So Social Security will always communicate through US mail. And so that's one thing I just tell people, you know, if it's not coming to you from US mail, from Social Security, it's not true. Just hands down, not true. So.
Great, thank you. Thank you.
Could I ask a question?
Absolutely. Yeah. Please, Tom, go right ahead.
Thanks. I'm currently working. I'm 61. I'm not eligible yet, but my wife's coming up on eligibility. I'm covered by my employer's health care. Does it matter what we do? Should we just enroll in a no-cost plan for her at this point? She'll still be covered under my health care, but we have to sign up for Medicare or get penalized, is my understanding. So
people that are covered under employer-based plans need to do a really careful assessment First, by checking with the plan they're covered under. So some employer-based plans require a person to sign up for Medicare when they're eligible, whether a dependent or an employee. Others don't. So it may not be true that she needs to sign up for Medicare. It depends on the plan that you have.
What I heard from them was that it would become a secondary insurance, that we should
Okay.
sign up and it becomes secondary.
Okay, so yes, they do want her to sign up. So then it is going to work like they call a supplemental plan. So she would sign up for parts A and B. She'd have to
Okay.
pay for B, but any extra charges, Medicare only covers 80% of the costs. So the extra charges, the 20%, would then be covered by the employer-based plan. Does that make sense?
Yeah, I think so. I thought that the way they described it to me was the employer-based plan would still be primary. Medicare would be secondary.
Again, it's really important to know first what your plan is telling you.
Yeah.
Because different plans work differently.
Okay.
So, but if she has both, you're likely got full coverage, is what I guess I'm saying. And if you have prescription drug coverage under the retiree plan, you may not need to purchase, if it's credible coverage, and your employer-based plan should be able to tell you that.
Okay.
Typically is.
Okay.
She wouldn't need to apply for a prescription drug plan and pay for that until she loses your coverage.
Okay. Okay.
Yeah.
Got it. I'll go back to them and try and figure it out.
In. Yeah, that's where the penalty comes in. So.
Okay. And then if she signs up for something that's, I'll call it plan one, not plan A, B, C, but whatever she signs up for. And then she's got coverage through my employer. If I leave my job at some point and lose my healthcare coverage, I need to enroll in my own individual. Can she change her plan at that point? Or does she have to wait for open enrollment?
No. So the triggering event is either age, when people get to 65, or the loss of employer-based insurance.
Okay.
So when she no longer has the coverage under you, then she's eligible for, then she's eligible for another plan. So then she would buy a supplemental plan to replace what she's losing under you.
Got it.
Make sense? Yeah.
Yep, it does.
Okay, great.
So I think what I have to do is go back to my company and find out a lot more about what happens, who's primary, who's secondary. And then I can think about what I need to do for a plan once I know more about how her coverage might change.
Right. And really one of the questions is like, typically they say sign up for part A because that's free.
Yep.
That's the hospital. The physician coverage, you have to figure out if you need that. So the part B. So, okay.
Great.
Let me know if
Thank
you need
Tom.
to talk further about that.
Yeah, I think I will.
Okay. Yeah, it gets a little
I know I will.
not dicey, but complicated, making sure you've gathered all the information. Once you have all the information, it's fairly straightforward, but each employer-based plan is different. So
Okay. And I know who to contact inside my company, so that's great. And then I've got your phone numbers now, so I can call you. Then we can try and figure it out when I need to, if I need to.
Yeah, but feel free to contact me and I can give you some more resources too.
Yeah, that would be great. Okay. This is incredibly helpful. Thank you very much.
Yeah. Or one of the Sheba, the numbers that I gave you too. If it's a quick question, you can always call them. So.
Yeah. Is that a state agency? State government agency?
It's the Office of the Insurance Commissioner.
Okay.
Yeah. And the State Health Benefits Advisors Group is part of the Insurance Commissioner's office, but we're not state employees. So we're in other agencies. Some are community volunteers who actually do the Medicare counseling. So that's the program that I'm with. I'm not a state employee.
Okay.
Yeah, thank you so much, Tom, for your question. And I completely agree. I think it is just such a complicated web and everybody's situation is unique. So that's why I am so grateful to people like Marilyn and other Sheba advocates that help us wade through these complex issues. So thank you.
Well, it's complex, but the way I like to think about it, Katie, is it's customizable. So it's complex, but when you can work your way through it, you can customize your package to what fits you the best. Everyone likes to get their healthcare a little differently, and different things are more important to some people than others. I've had people that go, gym membership is #1. How do I get that? You know, and you know, it just really, I mean, that's an extreme example, but it just really depends on a person's situation and their priorities. And that's what I work through as a counselor.
That is such an excellent point, and I love that perspective on it. And I think just all the more reason to reach out and connect with somebody about your Medicare benefits, to really get an understanding, figure out what your priorities are, and then get some support and being able to understand and kind of put together your personalized package.
Yeah. Whether it's me or one of the other Sheba folks, just, you know, that's what we are there for. So
yes, absolutely. And Marilyn, I just really want to emphasize the fact too, so with Sheba advocates, your role is to be neutral. You're not selling, you know, for any which, you know, product. Your role is to really be a neutral party and to provide information. So just to emphasize that, and if you have any other comments or words about the role.
I do. That's a really important part to emphasize, Katie. Thank you. Our role is always educating the consumer. So I won't recommend a specific plan. I will point out what I hear, like I was talking with Sheila about what I could hear her priorities were. That's the way that I work. So helping the consumer identify their priorities, and then showing you the options that you have. And I always have access to all of the options. Insurance brokers have access to a lot of information about Medicare, but insurance brokers represent specific lines of insurance. So for instance, they may represent United Healthcare and Cigna, but they don't represent Kaiser. So they're not going to talk to you about the Kaiser program and compare it to the ones that they handle. They're going to talk to you about the ones that they handle. So Sheba is really important in that aspect, in that we have the full world picture of what's available. Sometimes people get education from us and then they go to insurance broker and say, can you give me that? That's fine, however that works. But we can also help people directly enroll. What we don't do is say, this one is the best one for you. That's always the person's decision. But I also have a lot of handouts and indexes to the plans that help with kind of side-by-side comparisons, which is hard to get. So those are really helpful. So, okay.
Great. Thank you for sharing that. Any other questions? I still have a couple, if Marilyn, if you still have time, but again, I just want to open it up. Okay. All right. Well, I'll just, oh, sorry, Tom, go ahead.
No, I'm sorry. I didn't realize I was off mute. No, I'm fine. Go ahead. Thank you.
Okay, got it. Oh, absolutely. So Marilyn, I'm just wondering really quickly, so, you know, as Tom mentioned, not quite eligible for Medicare, but for folks who are maybe nearing Medicare age, when's really the time to start reaching out, preparing, gathering information? Could you talk to us just a little bit about what that timeline might look like?
So I think an ideal timeline in my head would be 3 to 6 months before your birthday month, between 6 months and up to 3 months before, get general education. So if there's a presentation somewhere, or you want to meet with me and just get an overview and orientation to the whole Medicare world, get the Medicare and You booklet, and just kind of get a sense of what the big picture looks like. And then 3 months prior to your birthday month is really important, because that's the period in which you can actually sign up for something. So if you've done your general education and got a good sense of what you want, then in that 3 months prior to your birthday month, making a Sheba appointment and walking through your choices would be how, you know, I would recommend people doing it. Allowing for enough time to get a couple appointments in there is a really good idea, because a lot of times people have a pretty good idea, and then once we've talked through it, they're kind of down to like 3 different choices, and there's homework to do, because I can't answer questions about specific plans that the consumer might have a question about. One Medicare Advantage plan might have, like I was talking to Sheila about, might have certain benefits for hearing. Another Medicare Advantage plan may have different benefits for hearing. But the consumer has to talk to both of those companies, and those things take time. Making telephone calls to the companies to verify what the benefits are is going to be pretty important for some people. So, you know, definitely don't wait until the last 2 or 3 weeks before your birthday month, and don't wait until your birthday month. If you wait until your birthday month, your coverage won't be effective until your following month. And if you lost your health care as you've turned 65, you could have a window in which you don't have coverage. That said, you have a full 7 months of open enrollment to get into Medicare without penalties or health screenings from a supplemental insurance company. So you have the 3 months prior to your birthday month, and 3 months after. So you do have a little leeway if you don't quite make it, but you don't have forever.
Got it. So people should plan to actually enjoy their birthday month and not have to stress about which
That's
program
right. They
they're
should
gonna
already
enroll.
have been done with their Medicare choice.
Give yourself an early birthday present, get this figured out ahead of time. I know you had mentioned early on too that you have provided different general Medicare presentations through the Bainbridge Island Senior Community Center. People can meet with you. Those are really great opportunities. So if you're somebody who's in that boat that maybe isn't quite ready to for Medicare benefits, but you know you're going to be coming up on it, please be on the lookout for one of those presentations. They're really, really helpful. And then, yeah, as you get closer, start to think about, you know, enrollment and putting all those pieces together. Any other questions for Marilyn? So last question from me, Marilyn. I am curious, so if for somebody, if listening to this talk, they come away with, my gosh, this is fascinating. I would love to become a Sheba advocate. How do I become one? What do I do?
Yes, we would love to have you. It is true that although I do this as part of my work, the Sheba Advisors is also a community volunteer role. So the number that I gave you for the local Sheba should be able to get you connected. 360-475-3095. You can also contact me and I can get you connected directly with the volunteer coordinator. The agency that does our coordination right now is Peninsula Healthcare Services. So that's where we have a coordinator there for our work. So
wonderful. So again, if you're interested, you can follow up. It's a wonderful and very much needed program and role. So thank you, Marilyn, for your role and all of what you do.